even the dentists, they understand that if a person has big problems, huge problems with the posteriorology, I mean, you're like staying in a strange way, you're walking around in a strange way, it gives huge traction, huge stress to all the muscles of the teeth and all the connecting tissues. So that's, I mean, that's the easy part. But it starts really early, this story of the teeth. It starts already in the womb of the mother. It starts already during the birth process. Because as we're in the womb of our mothers, we are not really straight. I mean, we already in a certain angle, a certain position, and that might be very important during the birth process. That might be very important even later on in life. Because if the mother has huge adhesions between the intestine, for example, and the uterus, the mobility of the uterus might be restricted. Or if there's like a huge scar of an operation that she had, it might be that the mobility of the uterus is not ideal, or because of other stress factors anyway. These might influence the position of the child in the womb of the mother already. And it might be that a child is really, really pushed, or really straight, really, really very little space in the womb of the mother. So even C-section babies might have problems with the posturology, with the position that they were in the womb. It's not only during the birth process, but what happens during the birth process, and it's really, really obvious, and really, to me, I mean, it's really obvious because it's my job to look at it. But during the birth process, the baby gets a really huge pressure on the frontal and the rear side of the head. This is how it starts. And then the movement is continued in a rotational movement. Mm-hmm. But at this point in the womb, the head and the bone is not so much solid as it is right now in our heads. So it's like clay. It's like giving compression on clay. So there will be deformations. There will be strange positions. And you see, I mean, babies are very nice to see. Babies are very beautiful to see. But if you get the eye and if you get the professional background, you see that not all babies are that beautiful, in the sense that some babies might have a huge, have a huge compression on one side. So the entire side of the head is flat, the back side, the front side as well. And you see it until the eyes, the position of the ears is really important. The symmetry might be completely lost.